Good afternoon, everyone. This is Christine at Health Current, and thank you again for joining us for the EPCS Prescribing Limits and Requirements, including oral, written, facts permissible situations webinar today. The presentation is provided through a shared commitment between Health Current, Arizona's Healthcare Cost Containment System Access, and the Arizona Department of Health Services and the Arizona Board of Pharmacy to manage and coordinate the statewide EPCS Click for Control education campaign. Just a few logistic reminders. Today's webinar is being recorded and posted to the Health Current website. We encourage you to use the chat box for questions or comments. And as always, please include your name, your practice organization, and please do not include any confidential PHI information. With that, I would like to introduce Connie Ide, our Director of Programs, who will be presenting today's webinar today. Hi, Connie.
Hi there, Christine. Thank you so much. Hopefully you can still hear me. I apologize for the delay here this morning. I had surgery this week, so this is my first day back. So I was struggling a little bit with some confusion in my little mind, but I think it's okay now. It's hard time. Anyway, what today's overview of today's presentation is, we're going to talk about when you can handwrite prescriptions and how to go about record keeping. It's a question I get a lot. We're also going to talk about the CSPMP, which is the Controlled Substance Prescription Monitoring Program, how to get to it and how to access it. And just so you know, it's a brief overview of it. We will have a August presentation, which will be the actual full presentation about the Controlled Substance Prescription Monitoring Program. So I encourage you to participate in that. And we will also talk about Click for Control campaign resources. And I think I maybe skipped I think that's it. So I've kind of split this apart as well as I could by splitting it apart as what is medical practitioner responsibilities and what are pharmacy responsibilities. And I know we most often have only practitioners on the phone, but today I realize that many of the things that the pharmacists have to do is basically the same thing that the prescribers do. So I wanted to combine them together so that you had an idea of what each other is doing. A little bit of background: beginning January 1, 2020, each prescription order must bear the name, address, and federal registration number, your DEA number of the prescriber, and contain only one drug per order. Unless it's a hospital inpatient, then you may do more than one drug. Multiple drugs are acceptable. Medical practitioner limits and requirements. Initial Schedule II controlled substance prescription must be limited to 5 days, except 14 days limit following a surgical procedure, oncology diagnosis situations, and traumatic injury pain management are some exclusions to that rule. I should also tell you, if you look at the bottom of each slide that you're looking at, you'll see HB 2075. That stands for House Bill 2075, where all of these rules and regulations are. And you will find I also have included, like, Section 36, line 2525 will tell you where this exact information is located in the House bill, if you wanted to go and check it out. Some other initial Schedule II controlled substance limits to 5 days, except hospice patient and end-of-life situation, palliative and/or skilled nursing facility patient, burn and MAT. MAT, of course, is medically assisted treatment patients, and infants being weaned off of the opioids. Now let's talk about pharmacist responsibilities, and you'll see how they blend together with the prescribers as well. Pharmacist limits. Schedule II controlled substances can only be dispensed with an electronic order. So if you send in most situations, there are some exceptions to that rule, but I'll tell you about those. They can only be dispensed with an electronic order, so don't send the pharmacist over a written order and expect him or her to do it for you. They cannot. They will be going against the law if they do. They may not dispense more than 90 days after the date of the prescription order. I often see situations where a prescriber is giving a snowbird a long-term prescription order for 90 days, maybe 2-3 of them to get them through the summer season and back to Arizona. The pharmacist cannot dispense if that prescription is over 90 days old. So keep that in mind if you're doing that for some of your snowbirds or anyone else for matter. And it may not be refilled. So if you give to someone a 90-day order, they can only do 90 days. They can't refill that order. You can't. You must do a new electronic prescription to get the order filled again. Pharmacist limits and laws again, if authorized verbally by the prescriber, and here we go with a little bit of exceptions to the rule. A pharmacist may correct errors or omissions on a written EPCS order. The following things: the date issued, the strength, the dosage, form, the quantity, and the use directions. If he or she finds something wrong or the prescriber calls and explains it, those kinds of things can be changed by the pharmacist if they're willing to do it. Again, if the authorization is, if it's authorized verbally by the prescriber, the pharmacist may document changes made to the time, date. Prescriber granted authorization to correct the order. You need the name of the prescriber who granted it, and also record that information on the original order that was received in error. What is not covered in this presentation, I wanted to make that clear so that you didn't feel like you didn't have anything to do with these kinds of things. To be compounded for administration by parental, intravenous, intramuscular, subcutaneous, or interspinal fusion is not covered in this presentation. Long-term care facility residence and hospice care is not included. Controlled substance dispensed to consumers like parents, not covered. And veterinarian prescribing and dispensing is not covered in this presentation. Now let's talk about medical practitioner and pharmacy responsibilities, and they kind of go hand in hand. So that, again, as I explained, that's kind of the reason that I've put them together. Written Schedule 2 controlled substance prescriptions. A medical practitioner may write, in other words, handwrite, and the pharmacist may dispense a handwritten if the electronic prescribing system is not operational or the pharmacy management system is not operational, either one of those. Both must maintain records of the system where it's not operational or available. So in other words, if you as a prescriber need to write a prescription because your system is down, your e-prescribing system is down, then you must keep a record of that. And if I were you, I'd be very careful about the way I kept the record in case something would happen later. Your board of registry, the board of pharmacy, decided to investigate or check it. You would be able to see exactly when it happened and why, and you'd be able to verify it with either your Wi-Fi, if that's the reason it was down, or with your vendor if their system was down as well. That is very important. I've heard of situations in other states where they haven't kept records, and I don't really know what the penalty was, but I know it was not a pleasant situation for the prescriber or the pharmacist. Again, emergency situations, a pharmacist may fill an orally ordered and dispensed. The pharmacist must transcribe the oral prescription order containing all required information except the medical practitioner's manual signature. So if something is an emergency situation, there's a bad car accident, whatever that might be, the fires that are going on nowadays, if the practitioner calls the pharmacist, gives the oral order, The pharmacist must transcribe it, write it down, either put it into their system electronically or write it manually, and save the written prescription so that the prescriber can update the information later. They can either do it via through their electronic system or send a written prescription to the pharmacist, seeing they did do the oral in the beginning. In emergency situations, the quantities of the Schedule II can be orally ordered and dispensed. So the medical practitioner must deliver written or electronically prescribed order to the dispensing pharmacist within 7 days. So if you order orally emergency quantities for one reason or another, then you must deliver a written or electronic prescribed order to the pharmacist to follow up the order within 7 days for anything that you do orally. More on written controlled substance prescriptions. Medical practitioner may write and the pharmacist may dispense. Prescription orders for federal facilities, and that includes the VA, military bases like Luke, Indian Health Services hospitals or other Indian Health Services facilities, or tribal-owned clinics, patients. So if you are seeing a tribal-owned clinic patient, you may write the prescription and send it with them, because where they would have it filled in their federal pharmacy, they are not required to have a electronic prescription. They often don't have an electronic system, so they have to have a manually written. So keep that in mind if you're seeing any of the federal situations. Let's take a look at what's going on. Where is Arizona versus the nation in e-prescribing? Unfortunately, we are now 4th in the nation. This is as of May 2020. We were 3rd in the nation at a point earlier this year, but other states are catching up to us because of their mandates. Where we really jumped was when our mandate went into effect in January, or actually November, December is where I was seeing it really go up. So in May, we're kind of holding steady because most of the folks, I believe, within the state of Arizona are already signed up and using their electronic prescribing system. It was kind of fun, not funny, but sort of entertaining. In January, I had over 40 calls from docs or prescribers who were not up on their electronic prescribing, hadn't bothered to go up on the any electronic system. And so they wrote prescriptions, which of course were sent over to the pharmacy by their patient, and the pharmacist was unable to fill the order. So we got those folks up and going. And I think this month so far, I've had one provider call me and say that they need help getting up live on their EPCS. So just so you know, we're at 4th. I don't know what's going to happen as we continue to go on. I'm going to try to do some statistics and see how many prescribers, prescribers in the state actually have a DEA license, how many of them are actually using them, because a lot of prescribers keep their DEA license up to date, but then don't use it because they're in a different kind of practice where they don't need it, but they keep it just because they want to have it. So then consequently, they don't, are unable to, if they are not using it, our rate, our rank is not going to go up because not more folks are going to be joining. A little bit more information. As of May, nationwide was 52% of prescribers were EPCS enabled, and in Arizona, 72% of our prescribers were enabled, according to SureScripts, and I've given you the link to it down here on the bottom. Let's take a look at what's going on with controlled substance. The CS-PMP are often called the PMP. Let's take a look at what's required here. What is a PMP? It's a state run. It's run, each state is required to have it, a database that collects information about controlled substances, and you are required to go to that system and that database and check out your patient. What is the purpose? Of course, it's to improve decision-making, clinical decision-making, stop doctor shopping. And we've also seen a decrease in it since folks have been using it. It's inappropriate prescribing, reduce the diversion of controlled substances, all the things to try to make the opioids and controlled substance situation that we're having in our state and the nation help mitigate it. That became mandated in October of 2017, when all prescribers are required to access that information and find out what's going on for the past 12 months for their specific patient. Just so y'all know, the Board of Pharmacy keeps track of who it has and matches up any controlled substance and that's been prescribed in the state of Arizona, and to make sure that that patient and doc have gone and looked up their patient on the PMP to make sure that they aren't, for the past 12 months, haven't had a lot of different prescriptions, and which may mean they shouldn't be getting the one that he's just prescribing at that time. So let's take a look at where you can go to look at the requirements for the medical practitioner. I've given you the link there so you can review the Arizona Revised Statute. And what are you required to do? As I just said, you're required to review the preceding 12 months of the patient's record before you go ahead and prescribe any of the opioids listed in the Schedule 2 or 3 or 4. And also exceptions to reviewing the patient record are listed there. Medical residents must register or may register using the hospital's DEA number. The prescribers must register there, where I've given you the link, and prescribers as well as the PAs must use their own DEA number unless they're a medical resident. And let's take a look at, there are a couple different ways that you can actually go in and use the prescription monitoring program or get to it. The best way, of course, is line B, which is access to your medical records. Many of the EHRs, many of the health record companies, are now providing a link where you can go directly from the EHR into the Arizona or whatever state you're prescribing in, the Arizona PMP, and check your patient. You also can get there via the Board of Pharmacy website. Sign into the Board of Pharmacy website, take the link. That takes you to the login page, and you can log in there. Also, if you are a Health Current HIE, Health Information Exchange participant, you can go into the HIE portal and do the checking. Before you can do that, you must go to the Board of Pharmacy website and register for our participation in the PMP. It's very easy. There are a lot of different items on the Board of Pharmacy website that teach you how and give you all the information that you need, even some webinars and some little video kinds of things, so you can understand better how to go ahead and register so that you're in compliance with the mandate. Continuous medical education. Let's look what's available out there. Probably the most exciting thing that I've been able to let folks know about beginning in 2019 was that there was there's a website with a free continuous medical education for CME opportunity. I've given you the link here. It was put together by the Osteopathic Association and ASU. So it's there for you to use. It's free. Go ahead and do it. It's an online kind of thing, so you get to do it when you need to, and then be able to put on hold and go back and do the course without having to do all of it at one setting. So that's good news for everybody that needs their CME. Where can you get information to help you with the clinical, with EPCS? We have a lot of information on our Health Current website. If you go to our website, I've given you the links there, you will find the controlled substance area. There's a lot of different information there. There's two pages. There's a page for regular e-prescribing as well as EPCS prescribing. So you can go to both pages and figure out how to register and how to get yourself involved in both areas. There's fact sheets with basics on getting started and frequently asked questions, all kinds of information there for you. There's also future and upcoming webinars, which I'm going to show you for here in just a few minutes. There's also newsletter articles and newsletters, and if you want to be included in our EPCS newsletter, send me an email and give me your email address, and I'll add you to it so you get the updated slides and information. There are also slides available that I can send you to include in any scheduled presentation that you may have that you want to do internally. So I can share some slides with you so you don't have to reinvent the wheel there. And also, we are available to speak at any of your conferences, or if you want us to do a webinar. I did one last month, I believe it was, for the rural health folks. I've done it for the telemedicine. There's all kinds of different things that we can do and we're happy to do. We also offer that same kind of service for the HIE, for the Health Information Exchange. If you want to know more about it or you're not now a participant, we can help you figure out how to become a participant in the HIE as well. We also offer additional support. So you can call us on the phone and I'll give you my information in a little bit. I'll put the slide up about it. You can get phone help. You can also send an email, and I'm glad to answer. And those of you that have ever called me, you'll find out that I will answer your question verbally while we're on the phone talking. But then I always try to send you an email afterwards with all the information that we talked about, so you don't have to write frantically while you're talking with me. Also on the website, you will find several flyers that will help a lot if you're trying to get some of your other providers that are not e-prescribing. A lot of times I find in multiple provider groups, they will have one or two folks registered to be able to EPCS, and they're doing the EPCS for everyone. If you decide that you want to get more of your prescribers EPCSing, then you can go ahead and look at these flyers and fact sheets, which will help you better understand and help them better understand. I don't have a copy of one up here, but I always suggest that because you're now e-prescribing electronic controlled substances, and you may not even be e-prescribing the legend drugs yet, but if you when you begin e-prescribing, if you hand your patient a flyer that explains what e-prescribing is, what is the benefit for the patient, that they don't have to take their paper prescription into the pharmacy, sit down and wait for it, or come back, make another trip back to the pharmacy to pick it up. It will be at the pharmacy before the patient can actually get there in their car, because it's instantaneous. They need to understand that. I also think it helps the patient understand, because they're walking out of there knowing they have a prescription, but they don't have the piece of paper that they used to have in their hand. So if you give them a copy of the this flyer explaining everything, they have something to remind them, and also something that lets them know that that it's for their benefit as well, and put on there some of the things that it's helping in the opioid crisis and those kinds of things. Okay, let me get back to where I was. There we go. We have a couple more webinars going on. Today is the June 18th one, and then on July 16th, we'll be doing another one on board certified physician assistant limits and requirements. So I believe the registration for the top two are right, but I don't think I got the bottom one done. The bottom one is in August. We will be sending out a flyer and more information, some newsletters on when the one in August is. So this is wrong. This May 21 is wrong. So please keep that in mind. I apologize for that. And I also want to let you all know that this webinar is intended to educate and help you so that you can navigate what has to go on to get you to EPCS. But I encourage you to review and interpret the legislation and mandates based upon your specific situation and needs. In other words, this webinar is not meant to tell you exactly and everything that you need to do within your practice. It's to give you a hint and idea of what it is you might need to look at. And also, if you're concerned, you should call the Board of Pharmacy and talk to someone who is educated and trained and hired to do that kind of thing. I am educated and trained to provide the information to you, but I am not allowed to help you understand just what you need to do in your own specific situation. Here's my contact information. You can contact us. That's my direct telephone number there, my direct line in the office, or you can call my cell phone, which I don't have on here. But if you call the main number or leave a message for me on while we're social distancing and while working from home, that 7210 number is my office number. So call the main number, they will answer. The main number is the one below, the 7200, and they will give you my cell phone number, which will get you to where you need to be. Additional resources, I've just given you a slide here that you'll get when Christine sends you the slide deck. Tells you how to get to the House bill. Some other items here that will help you understand the basic Opioid Epidemic Act, which is the bill text that you see on the third set down there, and also a policy primer that tells you a little bit more about it. And then also House Bill 2075, which extended the deadline and gives more information for you. And some more information on House Bill 2075 that will help you better understand what it is. And that is the end of my presentation today. Christine, do we have any questions in the chat box?
Yes, Connie, we do. One of our participants today has asked about his organization has an EHR that is very problematic for EPCS provisioning and will often throw errors that require arduous troubleshooting. Therefore, some of our providers struggle on a daily basis to provide the EPCS information to pharmacies, and pharmacies continually return calls to get more clarification about why the doctor is paper prescribing, or they refuse to fill the script completely, even though there is justifiable technology reason for that provider to write a paper script. So the question comes, what should their providers be doing to avoid continual delays in getting pharmacies to fill scripts? And there's a couple follow-up questions to that, including, why do pharmacies continually call for clarification on a script that has a note on it which says they are not able to prescribe narcotics at this time? And how do they avoid too seemingly unnecessary back and forth while they are working on the IT side to finish troubleshooting and get the provider functionality in EPCS? I am this message to you because it is lengthy, and we can kind of pull it apart through Teams, so you could reread that question and be able to answer it.
Okay, I'm signing into it right now. I am very sorry to hear this. This is not a good thing for your practice, and I apologize for that happening. What I would suggest, first of all, understand that the pharmacist is under laws as well to only fill prescriptions that are EPCS, electronically prescribed. Your first step would need to be to go back to your vendor to help better understand, is it maybe something that can be fixed within your system? Is it something that may require additional training for your prescribers? That's what I would suggest doing, because this is certainly not acceptable. So what I would also offer to you, if you call me so that we can talk through this, because I would like to know the name of your e-prescribing system so that I can maybe help you get with them and help them provide better software to you, because I imagine you're paying for it. And if you're paying for it, you should be getting a product that's working for you. So please give me a call, and I will work with you to try to get your EHR vendor to better train you or offer you better software. Sorry, I can't be of more help, but that would be, I'm offering to help you that way. Hopefully that answers your question, at least gets you to where I can help you.
Yeah, Connie, and I'll also follow up with the gentleman that asked the question and make sure that he gets your cell number to be able to follow up with you as well.
Right, I can tell it to you right now because I don't mind who has it. Everyone calls me on my cell, especially during this time of working from home. My cell number is 480-309-4529. Again, 480-309-4529.
Great, Connie. I'll include that in the chat box for everyone to be able to see as well.
Thank you.
Are there other questions out there for Connie? Again, please use the chat box to pose those questions, or following today's presentation, you're welcome to reach out to Connie on her cell phone. Not sure if folks are typing, Connie, but we'll give them just another minute or two.
All right.
Connie, I'm not seeing additional questions come through the chat box at this time.
All right. Well, if anyone has additional questions or whatever, give me a call, email, whatever. I'm happy and willing to help.
Wonderful, thank you. Again, just a reminder to today's registered participants that you'll receive a copy of Connie's presentation following today's call. It has been recorded, and once the recording is available, we will post that to the Health Current website. I am not seeing any additional questions at this time. So again, thank you for participating in today's webinar. A special thank you to Access, ADHS, and the Arizona Board of Pharmacy for joining Health Current and supporting this webinar. And thank you all for participating. Stay safe out there and have a wonderful rest of your day.
Thank you, Christine.
Okay, thanks. Bye-bye.